Hi, everyone. Thanks for being understanding. My daughter is home sick today, but I didn't want to let the day go by as we missed last week with the holiday on Monday and a snow day on Wednesday. So we are going to pick up where we left off, talking about different disorders of the skin. Last time we discussed the different components of skin, different layers, the dermis, epidermis, and hypodermis. We talked a bit about dermatitis, skin cancer, and we left off with discussing different bacteria, fungus, um, parasites, and viruses that attack the skin. So today we're going to move forward. If you have your note guide in front of you, it'll be helpful and you'll be able to fill it in. So we're going to pick up with other disorders of the skin, collagen diseases. If you remember, collagen is the component of skin that kind of gives it its strength. And some of the disorders that we'll talk about affect collagen and make it hard for people to move, affect the different body tissues, and can really damage a lot of organs. The first one, SLE, stands for systemic lupus erythematosus. I don't expect you to know that, just wanted you to know what that meant, but we commonly call it lupus. It's an autoimmune disorder, meaning again that the bottom attacks itself, and it has systemic symptoms. SX is a abbreviation for symptoms. If you're looking at the pictures in front of you, the one on the right is a typical characteristic lupus rash called a butterfly rash. You can see it goes over both cheeks across the nose. Very characteristic of lupus. A lot of internal diseases have external manifestations, which is another reason why being familiar with the skin and nails is important. The picture on your left is an example of rosacea. Rosacea can look very similar to lupus. They both have flare-ups and remissions. There is no cure for either one of them, but rosacea is much more benign. It is not considered a systemic disease, so it only affects the skin, and the redness is due to enlarged capillaries. Both of these are treatable. There is no cure for either one of these conditions, but lupus is much more significant. There's medication that will try to calm it down to keep people from flaring up and to keep it from damaging any of the other internal organs, such as the kidneys or the heart. Scleroderma, this is one you may not have heard as much about, not quite as common as the others. But again, there's an increased amount of collagen, which hardens the skin and makes it very difficult to move. And you can see from the picture the skin and the nails are overgrown, they're hard, the skin starts to die, and what it's doing on the outside, it can also do on the inside to the heart and lungs and kidneys. Etiology or cause is unknown. Again, it is considered an autoimmune disorder, so the thought is that there is a trigger, something triggered the start of this disease in susceptible people. Treatment is not as great. They don't know as much about this disorder as some of the others, and it is just a chronic progressive disease. We're going to talk a little bit more now about the different glands that we have in our body. The sebaceous glands, we mentioned those before. These are in one of the lower layers of the skin in the dermis, and they open up into the hair follicles and they secrete sebum. Sebum, we said, is that kind of waxy fluid that gives hair its moisture, can give skin increased moisture. Increased sebum production and secretion occurs during puberty, which is a leading cause of acne. So here's an example of acne on a young girl. The hair follicles, there's hair follicles all over your face, even if hair is not actively growing. It gets blocked by the sebum and the breakdown of cells, which is what forms the whiteheads or the blackheads. That pus that comes out is sebum and keratin and dead cells. And why we don't recommend popping those, whiteheads or blackheads again, because when they're there, the skin is intact. And once you break the skin, it creates an opening for bacteria, and you can end up with not only acne, but also secondary bacterial infections. Some common terms that you'll see when discussing acne or other types of things, I just wanted to kind of explain the difference because they can be similar. Cysts are generally fluid-filled sacs, but oftentimes they're kind of semi-solid or a solid substance, but that's very contained. It has its own epithelial lining cavity, so cysts don't tend to spread anywhere else. It's its own little sac. A comedo is a medical term for the whitehead or blackhead that we just saw with acne produced by too much sebum production. Pustules are very similar to blisters, but where blisters generally contain a clear fluid, pustules again tend to contain pus, which is really just a collection of dead cells. We have millions of sweat glands all over the body. We've talked about them before. The main function of sweat is to be able to cool the body. It allows us to perspire, but we have different types of sweat glands that you should be familiar with. Merocrine are the ones that are most common and found all over the body. Apocrine are sweat glands that produce more of a distinct smell, so we see them in the axillary region. Again, more thick, cloudier secretions versus the more clear type of secretion that you see from a typical sweat gland. Ceruminous. Cerumen is a term for earwax. So this is normal. It's your body's natural way of lubricating the ear canal and flushing out any kind of dust or debris that would get inside it. And then the mammary glands, which are in the breasts and secrete milk during lactation. Hair. So again, originally it was originally thought to provide warmth, but today it really doesn't have a whole lot of specific function. But as we age, our follicles shrink, we lose some of the melanin, the pigmentation in our hair, which is responsible for gray hair. We tend to lose hair becomes a little bit thinner. And I know we talked about this before, where is axillary hair found? And your axillas are your armpits. Talk a little bit about fingernails. So fingernails are constantly growing. They're made up of layers of keratin, and as new cells grow, old ones become hard and compacted and grow out. And they grow out from the base of the nail at the cuticle, which helps protect the new cells in the nail bed. Onychomycosis and paronychia. There's pictures on the following slide we'll show you. Onychomycosis is a fungal infection of the nail. Paronychia is an infection alongside the nail, oftentimes more of a bacterial type infection. I'll show you some pictures. This is a typical fungal infection of the nail. The nail becomes yellow, brittle, lumpy, misshapen, discolored, cracked, not a healthy looking nail. About 50% of all nail disorders are caused by a fungus. You can treat them, but they're very hard to treat, and oftentimes the medication that you have to take for them is oral, and that oral medicine you have to take for usually a long time, often several months, and it can be toxic to the liver. Again, funguses usually grow in dark, warm, moist places. This is an example of paronychia. You can see the nails, especially the one up towards your right, looks like it might be forming a little blister. It looks swollen, red, looks like it has some drainage coming from that. So again, paronychia is most often the result of a staph infection. So again, getting manicures and pedicures and ripping out the cuticles at the nail bed are a very common cause of paronychia or bacterial infections in the nail. But you can also get them anytime you have an opening in the skin. Fingernails and toenails can be reflective of other systemic disease as we go through the semester, and you can learn to look at the nail bed. It can help with hypoxia, low oxygen, malnutrition, streaks or lines across the nail can refer to different types of vitamin deficiencies, so they can offer clues as to what might be going on with somebody. Next, we have a picture of an ingrown toenail. These are very common and most commonly result from people trimming their toenails the wrong way. On the left, you can see the toenail was trimmed too short. Most people try to round their toenails so they look nicer. It's best if you just leave them cut off straight. When they're rounded, as you can see in the picture on the right, it has a tendency to round and dig into the skin. Very painful, hard to walk. Oftentimes surgery is required where they'll have to cut the skin to be able to get that toenail out, cut it down, and allow it to grow out properly. Moving on to burns, which might be a bit of a review for most of you. We'll talk about first, second, third, and fourth degree burns. First degree burns are more superficial, so you can see in the picture it just affects the top layer of skin, the epidermis. This is your typical sunburn or short exposure to a hot surface. If you went to grab a pot off the stove and you forgot it was hot and you just touched it for a second or two. It's red, it becomes painful, it might be swollen, there's no blistering, doesn't leave any scarring, really don't need any kind of medical treatment, can run it under hot water. If it's a hand or something you touched, to try and stop the cooling process. But usually within several days, the pain subsides, and again, there's no long-term side effects from a first-degree burn. So these are often called superficial burns. Second-degree burns are referred to as partial thickness burns. So second degree is a little worse, so it burns through the epidermis and into the dermis, the second layer of skin. Again, they're red. They're very painful. This is more of a blistering type of injury. So prolonged exposure to the sun where you get blisters, prolonged exposure to heat where blistering, you may or may not get scarring. That'll depend on how big an area was burned and how quickly it was cooled. You may need medical treatment. A burn cream might be required. Again, blisters, keep them intact. The fluid that accumulates underneath them is sterile, so they are not infected. When they pop, then you have an entryway for bacteria. So as best you can, you don't want to pop any blisters. Keep them intact as long as you can. Healing for these will take a little bit longer, and you might notice these, since they are kind of blistered and fluid-filled, that the skin starts to seep a little bit. When you get burns, the skin becomes edematous or swollen, and fluid can start to seep through. Third-degree burns are called full-thickness burns. So again, it's going through the epidermis, the dermis, and you're into the subcutaneous layer, that hypodermis. These do require significant medical attention, just as you can see by the picture. When you're burning that low, now you've burned into fat, and you've burned into blood vessels and nerves, which is why third-degree burns may not be painful. If it's burned that deep, it has burned the nerve endings, and they won't be able to feel it. Any pain they have would come from any first or second-degree burns that are surrounding the wound. Lengthy healing time, stays in the hospital, probably going to need some type of skin grafting for that. High risk of infection with burns. And again, when you're looking at burns, you have to think of why someone got a burn. If it's a house fire, not only are we concerned with an extremity that might look like the one that you see now, we also have to be concerned with smoke inhalation and damage to the lungs and breathing difficulties. So third-degree burns are much more significant, definitely requires medical attention, definitely some scarring, and again, probably some skin grafting is necessary. Fourth-degree burns, you can see, destroy everything. They go from the top layer, through all the layers of skin, down to the muscle, and down possibly to the bone. In this picture, you can see the white there looks like it's hit all the way to the bone. This is usually some type of electrocution, really significant and prolonged exposure to heat or fire. Again, at this point, the extremity or wherever this is on the body is probably not the greatest concern. If it was deep enough to go there, you'd have to worry about shock. If it's an electrocution, you'd have to worry about the heart. If it was an intense fire, you'd have to worry about the lungs and respiratory problems. Definitely going to require skin grafts here, there is no tissue left to regenerate in that area. So most definitely is going to require a skin graft. We talk about different types of grafts. An autograft, auto means itself, so that's a skin graft that's taken from another site on your body, so possibly from a thigh or from the rear. Heterograft, hetero means different, so this is a graft taken from another species. Put a pig there, so for example, people who end up with needing heart valve replaced, sometimes they get replacement from pigs. And an allograft, allo is a synonym for homo. Homo means the same. So this would be a graft taken from another person. So doctors, plastic surgeons are very good with grafting. What they worry about most, especially if it's taken from another area, another person, or another species, is tissue rejection and how well it takes with the part of the body. Does it grow? Does it stay healthy? Or does it become necrotic and die? That's a lot of what they have to look at. It's a long process. And we'll finish up our last couple of slides here with wounds and tissue repair, and we'll talk a little bit about scarring. Difference between a laceration and incision. Lacerations tend to be more superficial. Incisions are deeper. Think of incision as, a surgical incision. They're usually cutting deep, trying to get down to something. Blood vessels become broken. Lacerations tend to heal a little bit quicker than incisions. Incision, depending on how deep it is, may require stitches or suturing to help the wound fill in and heal the right way. Scab formation, I think you're probably familiar with that. When we have any kind of laceration or incision, bleeding occurs, platelets rush to the area, forms a blood clot. To stop the bleeding, scabs form. Scabs, like blisters, cover the wound and keep it free of bacteria. So as long as a wound was washed out good and a scab forms, there should not be an opportunity for infection. So not picking scab or continuing to reopen it because that will reintroduce the opportunity for infection. So when it's intact, when a wound was cleaned the right way before the scab formed, should keep it free of infection. Suturing you're familiar with, I'm sure, which is the process of bringing a wound together. There's lots of different stitches they can use. Absorbable, which they'll use more on internally, that your body will just absorb over time. Non-absorbable are the type that you need to get out probably within about 10 days or so. And a liquid adhesive, which is like a glue. You can even buy that over the counter now for certain types of wounds, depending on the area of the body and how big it is and how well it comes together. They might be able to glue it together rather than stitch it. And then we'll finish up with keloids. Think of keloids as scars that don't know when to stop. They are not normal scars. They can become lumpy, bumpy, extend well beyond the border of the wound. So this looks like an ear, possibly an ear piercing. Excessive fibrosis, so they're hard. They don't go away. They will not subside over time. Much more common in places with any kind of injury. Piercings, see them commonly with belly button piercings. Burns, the cause is unknown, but they have found people with darker skin have a higher tendency to develop keloids. So hopefully you were able to go through this and fill in your note guide, as we will not be going over this in class. This is taking the place of class today. And you should plan for a quiz on Monday on the Integumentary system. If you haven't already done so, make sure you print out your note guides for the musculoskeletal system. We'll start going over bones and muscles, and then our first unit exam will cover the Integumentary system and the musculoskeletal system. If you have any questions, shoot me a message and I'll get back to you. Otherwise, have a great day.